Uh, we are so excited to announce here in Contra Costa County that we are opening up vaccinations to 16 and older. And, from the very beginning, we've declared that protecting everyone was a priority. And as the supplies increased and the guidelines have been allowed us to, we've gone as fast as we could. And so this is a great day because that means that anybody that's an adult that wants to get vaccinated can in Contra Costa County. And this is a testament to our staff who've worked hard from the very beginning to make sure this could happen. And it's a testament to our community for stepping up, getting in line, and getting vaccinated. 44% of Contra Costa County residents over 16 have already received their first dose, and almost 26% are fully vaccinated. So we've made a lot of progress. We've got a lot more work to be done. We need everyone to do their part by getting in line and stepping up and getting vaccinated. So I'm going to turn this over to our health director, Anna Roth.
Thank you, Chair Burgess. I'm excited to join you today. We know that there's a lot of questions about our vaccination program, and we just again starting with sort of the big highlights that our chair just sort of brought forward. We've since December 15th, we've given 630,000 shots in Contra Costa County. I just want to go a little bit over the breakdown because I know there's a lot of questions about that. And we know we started with health workers and the elder adults. So with 75 and over, we have vaccinated now 97% of that group. So 97% of people 75 and over. We've vaccinated 85% of people 65 to 74. And that's really important because we were seeing the majority of the deaths in Contra Costa County were really occurring in that senior population. We opened up to 50 and over a little over a week ago, and we actually are at now 45% of 50 to 64 vaccinated. And even though we're opening 16 to 49 today, there have been a fair number of people. There's about 500,000 people in Contra Costa County who are between the ages of 16 and 49. And already 137,000 of them have been vaccinated. So, we have we just have about 375,000 more to go. And those people have been vaccinated because they met the criteria because they're essential workers or they're health workers, perhaps their occupation, they may have had a serious health condition. So we already have 27% of that 16 to 49 already vaccinated. So, as we looked at our vaccine allocations and the amount of vaccine we had this week, we really felt it was time. We've been building up capacity actually before the vaccines even arrived. Our vaccine teams have been working very diligently to build up capacity, to really build big and to be ready for the time when we knew that the vaccines would start really slow and they will speed up on their arrival, and that we're starting to see that. So a lot of people are asking, how can you do this in Contra Costa County? Like how are you able to do this? And I can speak for one county, Contra Costa County. So I think it's really important we don't compare counties. What we can do here is talk about what's going on in Contra Costa County. One thing that we're doing is we're leveraging all existing capacity within our county. So since that vaccine has arrived, and even as before it got here, our vaccine teams through public health have been working both with our own county clinics, but also with partners across the county, pharmacies like Safeway, Lucky's, Rite Aid. We've been working with the fire district and the fire departments. We've been having small and large providers in our county, and lots of community-based partners, volunteers. We've sort of leveraged and activated every corner of our county to really get this vaccine out. So that's one thing, is we sort of harness the existing capacity within this community. And I just want to call out and acknowledge that capacity and all of those people, because it's people that make up that capacity. The second thing that is really the vaccine supply itself. One of the things that we know happened is in the recent weeks that the federal government started to provide very specific doses of vaccine through to federally qualified health centers. So the moment that that program opened up, we signed up our health centers. We have community health centers, and we signed those up right away so that we could get the needed vaccine that we really needed into those health centers, which are essential in our efforts to serve some of the hardest hit communities across Contra Costa County. So, and we knew a large supply of vaccine or increasing supplies of vaccine were on the way because we've been told this consistently by both our governor as well as the president. So we know that we expect, and we continue to expect, that even though we aren't out of the vaccine scarcity mode yet, we know that supply is coming because we are consistently hearing that. And I want to just sort of give a snapshot of what really is also informing our confidence in that. In the month of March alone, we went from 30,000 doses in the first week to that we were receiving from both the federal and state kind of combined. This week we had over 80,000 doses arrive. So it has put us in a position where we really can, I think, again, consistent with our message that, we knew that we expected vaccines to increase this month. Vaccines are starting to increase this month. I think we expect them to continue to increase. We expect that vaccines will become more abundant and more available in the weeks ahead. One simple rule that we've been applying is moving every vaccine that moves into this county, we move out and into arms as quickly as possible. So we don't want any vaccine waiting in refrigerators somewhere. We don't want, vaccine, sort of waiting somewhere to find a delivery system. That we have the delivery system. We've been saying that the whole time. We want to get that vaccine and those doses out to people who need it as quickly as possible. Again, I think, we just want to say our health centers have really been key because those health centers are located in sites across our county, actually in many of the hardest hit communities. Each one of those health centers has ultra low temperature freezer, which has been very helpful because most of the federal vaccine supply has been Pfizer, which does require the ultra low temperature. And I think, again, what we want really is, we know now that we're kind of we're approaching 50% of the population has had a dose. We think it's really important that, first of all, we have the capacity, we have the doses, right? We want to simplify this for our community. We want people to know, if you're 16 and over, it is your turn in Contra Costa County. We want you to go to cchealth.org and we want you to sign up. We want to eliminate confusion, uncertainty. We want you to sign up. Be patient with us. Give us some time. We know that in every time we've opened up a sort of a different eligibility group, we've gotten a lot of requests the first few days. We will sort through those requests. We will get you on the list. I think it's important also to just remind folks, we don't actually give appointments at a first come, first serve. We still do have sorting some criteria. First, every day we go through the appointment requests and we deliver appointments, invitations to those in the hardest hit communities using the Healthy Places Index tool to sort of determine those communities. Then we send out tickets to those who are at highest risk for severe disease. So that would be based on age. And then we send out the remainder, and we do that every day. If we don't get a lot of requests, we sometimes reset that and do it twice a day. But I want us to talk a little bit more about equity. And so I want to hand off to our Chief Equity Officer, Gilbert Salinas, who's going to take us through, I think, again, why we feel it's so important to sort of move forward in this urgent effort that we have to really get that vaccine out and specifically get it out to the hardest hit communities across our county. So with that, I'll hand over to Gilbert Salinas. Thank you.
Thank you, Director Roth. Good afternoon, everyone. First of all, I just want to say that it's urgent that we reach this herd community, as we like to refer it as in the county, as community immunity. If an entire family can make an appointment to get vaccinated together, I mean, think about how it would relieve the stress of family members having to miss work on separate days. At least 6 states have fully opened vaccine eligibility to those that are 16 and up. And by opening to everyone that is 16 and up, we eliminate the confusion around tiers and phases. It's very confusing for our community members. I'm constantly getting questions regarding this. And one example is a housekeeper that might get paid under the table. When does she qualify? Or the nanny who takes care of your children, when will she qualify or he qualify? There are members of our community that are not aware of who qualifies and when they will qualify. So this actually helps to eliminate those barriers. The more residents that get vaccine, the better ultimately it is for Contra Costa County, and the sooner we can get to this community immunity target. We need to vaccinate our younger population to help with stopping the spread of COVID-19. I'll just ask all of you, how many people do you know that got COVID-19 from someone in their family that was not aware that they had COVID-19 to begin with? Let's vaccinate everyone that lives in fear of getting their madres, their padres, their abuelos, their abuelas sick of COVID-19. Let's help them to get vaccinated today. We have also expanded our equity efforts in our hardest hit communities by increasing our mobile vaccine units. We are partnering with faith-based communities across the county. We are partnering with community-based organizations and our business community, well-established organizations that have been serving your community for decades. Our mobile vaccine clinics in these communities have increased from 100 vaccinations per clinic to 300 vaccinations per clinic several times a week. And we're continuously increasing those numbers. Next week, we have a community mobile vaccine clinic at St. Mark's Church in Richmond that will vaccinate over 600 patients. And we have plans to continuously increase these efforts in all of our historically marginalized communities. This gives our community-based organizations and churches the first choice and the first line access for getting these appointments. We will also soon begin piloting walk-up vaccination efforts and registration with no need to make an appointment. We will continue to work towards that as well to make things easier around things related to access. We just hired 19 community ambassadors, 3 program coordinators, 1 program manager to help with efforts for outreach by canvassing communities. They're helping to get residents registered right on the spot, providing face-to-face education and answering questions from our community. This past weekend at Sojourner Truth Presbyterian Church in Richmond, we held a vaccination event, and our ambassadors were helping with logistics, translation, observation, and providing any support that was needed to make the event a great success. And lastly, I do want to note that we are continuously working with our IT department and business intelligence team to use data to help us identify hotspots. We are using geo mapping for communities that have low vaccination rates. We have precinct data that we've been able to access, or we can specifically go door to door and get folks registered in those areas that have low vaccination rates. Our ambassadors will then canvass these areas and provide information on our vaccination sites and provide on-site registration to any of our clinics within our county. So these are some of our efforts moving forward. And just to give you a brief update, we started with about 400 vaccines a week in our vaccine clinics. Our allotment this next week, just so folks are aware, what we're requesting in terms of vaccine next week is 1,900 vaccines. That's based on some clinics that we're targeting for some high population clinics next week. So with that, I'll turn it over to Dr. Civelli, our Deputy Health Director.
Thank you, Gilbert. This is a really exciting time as we open up eligibility and vaccinate more and more of our community. I want to just emphasize that there's several ways to sign up for vaccinations in Contra Costa, but our county clinics are not yet on my turn. So if you are between the ages of 16 and 49, the way to sign up is to go to the sign up at cchealth.org. That's how you access that. Not on my turn yet. They'll add that eligibility on April 15th also, but for now it's at cchealth.org. I also want to clarify that for the youngest among who are approved, the 16 and 17-year-olds, they can only get the Pfizer vaccine right now. Everyone 18 and over can get all 3 of the approved vaccines, but the youngest ones can only get Pfizer. We do have Pfizer at all of our county sites. So just letting you know that, that just for the youngest ones. These vaccines are safe. Most importantly is that they work really, really well. They're some of the most effective vaccines ever created. They help prevent both disease and reduce the transmission. But I want to caution us that we're not done with this fight against COVID-19 yet. Our case numbers in our county have leveled off. Our hospitalization numbers have also leveled off. And we just this week received data from our coroner about a 15-year-old who passed away back in December of COVID-19. This is the first pediatric death in our county that we know of, and these are incredibly rare, but also very tragic. So it's just a reminder that we really need to get our community vaccinated urgently. Like it's a sort of a race between more people getting COVID, more variants developing when COVID goes unchecked, and our ability to control the disease, vaccinate everyone, and get back to a normal life. Some people are asking, how are we doing as a community on our tiers? We are right now in the red tier. We expect to go into the orange tier in about a week. Sometime around the beginning or middle of next week is when we anticipate that will happen. It all will depend on when the state reaches that 4 million mark for vaccine doses given for the lowest HPI communities. Right now, the state, I think, is at 3.4 million. So we're coming up on that soon. But I do want to emphasize that even in the orange tier, we need to continue to be cautious. We're not done with COVID yet. We need to continue to mask. We need to continue to socially distance. When we gather, it's safer always to do that outdoors rather than indoors, or have good ventilation indoors. Many states are seeing a rise in the number of cases. I think the CDC director cautioned about a potential 4th wave. So we just need to continue to be careful and cautious and be wise. You know, we fought so hard for so long, and we need to hold strong as a community while we get everyone else vaccinated. I'd like to hand it back off to Kim and Carl now before we take questions.
Okay, well, thank you all very much. Quick reminder that there are 2 ways to submit your questions. I have a number of them that I'll read through. If you have some you'd like to drop in the Q&A section, that works for us. If you want to raise your hand when we get to you, we will unmute you and allow you to answer your questions in person if you prefer to do that. So first question I think is going to be for you, Gilbert. The state prioritized vaccines for zip code 94801. Are these prioritized vaccines being given specifically to residents of that zip code? If not, how are we prioritizing 94801 residents to meet the state mandates?
In Contra Costa County, we actually have been providing vaccines to this zip code and all of our zip codes in respect to the lowest HPI communities throughout our county. So we have prioritized these zip codes in terms of utilizing our community mobile vaccine clinics, sending more vaccine out into these communities. So we have really spread this out throughout the county through our efforts, not only within our mobile vaccine units, but also within our stationary sites as well.
Thank you. So Ori, I think this is an operational one that falls in your category. When appointments fill up, when are new appointments added? On a weekly basis, are they being refreshed daily? Does the county have enough supply to accommodate appointments for the eligible 375,000 people? And if not, how long do we think it'll take?
That's an excellent question. We do open up more appointments every day. Our supply comes in on a rolling basis from both state and federal sources. So will we have supply to vaccinate all 375,000 in the next week? Probably not. We have about 20,000 open appointments right now as we speak, and we've started sending out tickets today as soon as we open. But over the next 3 to 4 weeks, I expect that us, along with our partners, La Clinica, Lifelong, a lot of community pharmacies, Kaiser, John Muir, Sutter, all of us together will be vaccinating about 100,000 doses a week. So I think within a few weeks, we'll be able to work through the backlog. So please be patient with us. We know in the next few days, you might not get a ticket immediately if you sign up. But you might, so please check your email and check your junk folder also. We know our phone lines are ringing off the hook, and you may get a hold message or you'll be asked to leave your number so that we call you back. So please do be patient with us. But we think that over the next few weeks, we'll be able to get to everyone who's asking for an appointment.
And I'm going to put you on the spot for that one as well.
Yeah, I think that Dr. Savelli covered most of it. I would just say that the one other thing that we do is we have some limits about how many actual confirmations we can send out. So even though you're on the list, we only have sort of license ability to send out 5,000 confirmations a day. So you might get your confirmation tomorrow or even the next day. You're still on the list. So, we'll catch up to you. That's number one. Number two is every day we open up 7 days from now. So we don't actually open appointments beyond 7 days. And I think that I know that in some cases, some regions you'll book farther out. One of the things that we've been really careful about is making sure that we screen people to get here when they actually can. So what we know is that if you book farther than 7 days out, you're more likely to come up, and the no-show rates will go up. I just want to thank our community, because our no-show rates have never exceeded 2%. They're usually closer to 1%, which is pretty much extraordinary. Having run, clinics for years, we've never seen this kind of show rates before. So I think, again, that is really, I just want to recognize the community for being really diligent about thinking about when you can make it, when you pick your appointment. And that's one of the reasons why we only open up 7 days out, because we know that kind of when you get beyond that, it's really hard to predict what you're doing 8, 9, 10 days from now. And the no-show rates go up a lot. And that's what leads to a possible, excess vaccine doses, which is, again, I think one of the commitments that we have is that we don't want to waste any vaccine. We want to move every dose into an arm. So that's another sort of piece of why those appointments we open up daily for 7 days from now. So
thank you. So Supervisor, I saw you nodding your head while Ori was talking about the race with the variants. And so I wonder, as you've gone about your work, we have a question about what messages you think are resonating in the community and what you've been telling your constituents.
Yeah. I just want to kind of back up what Ori and Anna were saying as far as the signing up. I want people to think of when you go to CC Health to sign up for your vaccine, you're actually signing up and getting in line. And so if you kind of think of it as you're getting in line and then they're moving the line along, that'll kind of make more sense to you, so that when we respond, you're not thinking you're going to get your vaccine right away. My message to everyone is to pretty much echo what Ori said, and that is, this is not the time to let our guard down. We look across the country and we look across the world, and we see that there are still a lot of challenges that different governments are facing with COVID. And so what we can do is get ourselves vaccinated, practice the social distancing when appropriate, wearing our masks and staying very committed to the hygiene. And I would also like to request that anybody that hasn't signed up, that they're getting signed up, and that people are helping each other get signed up, because this is what we can do.
Great. Gilbert, I think this one is for you. West County, particularly Richmond, is far behind its vaccination rates compared to the county average. How are you addressing this in the equity world?
The way we're addressing this is really bringing vaccine out to the community, meeting people where they are at. We actually today we had a very successful mobile vaccine clinic, and when I talked to folks at the clinic, you know, they were really excited about the fact that the folks that were in line were people of color. They were excited that they were from the community. They were excited that we are targeting these areas. So what we're doing is really having a strong focus on reaching these communities by bringing vaccine to them, ramping up on our mobile vaccine efforts throughout the county. We also have an opportunity to give folks appointments before they go out to the general public, which is something that we've been working on in East County with some of the farm worker population and community-based organizations like Hijas del Campo and the Village Community Resource Center. And so these are some of the ways that we are really focused on targeting these communities, focusing on the Healthy Places Index, lowest 25th quartile scoring communities, really with the focus to bring vaccine to people and meet them where they're at. Over the next few weeks, the next couple of weeks, we would have reached about approximately 7 different churches within Richmond through a partnership with an organization called One Accord. They represent over 30 churches in the area of Richmond and West County. And so we are partnering closely with them to bring vaccine to their communities. Following that, we will be moving over to East County and doing the same thing in a different part of the county.
Thank you, Gilbert. And we have a question about county residents versus non-county residents and how vigilant we are for making sure that somebody lives or works in the county if we provide them with a vaccine. Maybe we can talk a little bit about that.
Yeah, so we do actually, it's part of our pre-screening. If you go on to cchealth.org and you click the appointment to fill out a vaccine interest form, it will ask you if you're 16 and over and if you live or work in Contra Costa County. So we do screening up front. And I think I saw the back half of that, which is at this point, we are providing, you know, we're not there yet where we have our whole county vaccinated, but so we're providing that I think is a consistent practice across the Bay Area. And I'm not sure about, I can't sort of weigh in across the state, but I know across the Bay Area, that's a consistent practice. We do know that when we transition to My Turn, and as the whole state comes on board on April 15th, that we will be revisiting that. And that is sort of, I think, part of that, you know, it is a envisioned future that really, and I think the whole state is really looking to move towards a simplified access, simplified, you know, way to get your vaccine. And so we're moving in that direction as well. So, you know, you will find though that we do, the very first question is if you are 16 or over and you live or work in Contra Costa County. So we sort of start with that electronic and then we move out, and that's fairly consistent. I think absolutely consistent with the practice, but you will see a transition, I think, by mid-April as we start to transition more and more. The other thing is if you go on, and I just think, and we know that this can be confusing, but if you go on to My Turn is the state-run site, and they actually don't sort of view there. You can actually go live in Contra Costa County, sign up through My Turn, and go to one of the state sites like the Oakland Coliseum, which is in a different county. So I think again, you know, there's a little bit of transition, and it can be several sort of some navigation required. That's why, you know, what we can really speak to is we can speak to at cchealth.org in our county. If you're 16 and over and you live or work here, sign up. We want to hear from you. We want to make it, you know, we're trying to simplify this. And I think that's sort of, we've seen this, this aim to simplify happening across the state. So hope that helps.
Right. So I'm going to ask Gilbert a quick clarification, and then I have a question that I think several of you could respond to. So Gilbert, I think you said that there were a number of states that have gone to 16 and up before us, but we're the first county in California, is how we understand it. Is that correct?
Yes, I said there was 6 states, so that was my reference to it. But yes, correct.
Great. So Anna, maybe we'll start with you about talking a little bit more about why Contra Costa County is so on the cutting edge. I know you addressed this a little bit in your opening points, but maybe a little bit more about why we are first. And then I'll have maybe Supervisor Burgess talk a little bit about what that means to the county, and then we'll see where we get. So if you'll talk a little bit more about that topic.
I think I really want to start with, I think comparing, counties is not necessarily the best lens to use, because I know, we work really closely with counties across the state, and in particularly the Association of Bay Area Counties. We're working, in strong partnership with them. And so again, though I can't speak with, to what every nuance that's going on in other counties, what I can say is in our county, we've immediately, and I believe this is consistent with what's happening in other counties. We immediately started to leverage and access all of our capacity to deliver what we knew would be the largest vaccine distribution in our history. So we've been working on those relationships. And again, I want to really recognize both our outreach team under the leadership of Gilbert Salinas, our vaccine team under Dr. Savelli's leadership, and really our community partners, the other health systems, have everyone sort of stepped forward, locked arms, and we're ready and waiting for the vaccine doses. We've been saying that the whole time. So hopefully this isn't coming as a big surprise. And today we happen to be in the fortunate position to have enough doses. And we have the delivery system to really get those doses out. And we know that tomorrow, the next day, others are coming right behind us. So, we think that, again, what we really want to focus on is, rather than compare ourselves, really call out to the community. It's your turn. Please come and get your vaccine. We really want to, we're seeing what's going on across the county, the country. We're seeing, the decrease is slowing. We really want to get in front of a possible 4th wave. So again, I think the big message today is really, if you're 16 and over, it is your turn. Sign up at cchealth.org. We want to see you.
Yeah, and I will say that part of the reason why we have the number of vaccines here in Contra Costa is because we're a federally qualified healthcare system, which gave us an extra supply through the federal government. And as the new administration has indicated, they will be ramping up that supply. And so Contra Costa, I believe, is only one of like 15 out of the 58 counties in Contra Costa. Am I correct? I'm looking to my colleagues. I think that's something like that. And we were one of the first to be able to access that supply. And so I think that's where you're showing it. But I think Anna's absolutely right. This is not a competition. And everybody across the Bay Area has been working very closely to make sure that we're consistent and that we're trying to have similar messaging and similar approaches. We had an infrastructure already established because we do have a hospital system. So we were able to get those appointments for vaccinations and for testing. We had the staffing to be able to pivot and adjust to the things that we've needed to do. But this is not a competition. This is just something that we've been able to do. And I fully expect that we'll see other counties coming up and being able to do this shortly. So we're doing the best with what we have, and so is everybody else.
Great, thank you for that. Ori, will you talk a little bit about second doses and how we manage second doses?
Oh, sure. Yes, when you order, when you get your ticket to schedule your vaccine appointment, you will get your ticket for your first dose. When you show up on site and get your first dose, right there and then, it will automatically schedule your second dose for you, and you will have that in hand before you walk out of the vaccination site. That's how we will handle second doses. If you're someone who's already gotten a first dose somewhere and you need to come to the county for a second dose, when you get your appointment, just let them know that so that they don't schedule another appointment for you.
Another detailed question for you. What happens to the doses for the 1 to 2% of people who don't show up for their appointment? What is done to make sure those doses aren't wasted?
We have a backup list of people that we call every day who are in tier, and so we make sure not to waste them. Sometimes we are able to add them to the next day supply. It really depends on the staffing we have on each day. But we do anticipate there will be a day soon in a few weeks that we are accepting walk-ins at all of our sites, and we will actually have more appointments than demand. We're not there yet. We have to work through this backlog right now. And so for now, we are piloting. We're doing small pilots of walk-in options starting next week. But for now, we are we're asking the public not to come and hang out and hope for an extra dose. We don't have the infrastructure or the capability to handle that. We don't want a lot of people congregating and blocking the lines. So please just sign up online. We will get to you quite soon. As we've said, I think we're within 2 or 3 weeks of getting to really everyone who's waiting. We know all our partners are getting to many more. So, so please sign up online or through the phone line. That's the best way to do it.
Great. I have one more question for Ori. So if there are any other questions that any questions that didn't get answers, I was having a hard time following them in the chat. Feel free to drop them in the Q&A if we didn't get to your question. But Ori, we have a question a little bit more about the pediatric death. Why did it take us so long to find out about it? Talk a little bit about how that process works.
Oh, sure. Without sort of violating the privacy of the family, I'll just say this was a coroner's case. It was a child who was found unresponsive and ultimately passed away. And the coroner has a process that takes a number of weeks to determine the cause of death, do all the testing to really come up with a definitive diagnosis. To complicate things, this child was visiting relatives in a different county, so there was some county to county information transfers that caused the delay. But we only found out about it this week, and we posted it as soon as we did.
Thank you. Certainly our sympathies to that family. And I had one more come in that I think would be good for you. What cities will the walk-in pilots be held in next week, and kind of how are we going to roll that out?
So we don't have exact days. I think it's toward the end of next week. We will be piloting walk up in both Richmond as well as Bay Point. And I want to stress that we will announce that because we will have a limited capacity. Like almost everything that we've launched, we start very small, we work the kinks out, and then we open it wide open. So though we're going to pilot in a limited way, sort of in West County, in Richmond, and in moving to the east in Bay Point, this is really to work out all the kinks so we actually have some walk-in ability in the coming weeks across our system. So more soon on that. We'll post those details on cchealth.org. And we'll do some communication about that. We're still working out all the details on that. We also opened a drive-through clinic today at Hurricane Harbor, and there will be sort of more information on that. I think there's a press conference about that tomorrow. So I think, like everything, we're building consistently. I know people are really ready to hear all the details, and as soon as we have those details ready, we'll put them out again, like we've been doing on cchealth.org and through our media channels. So stay tuned.
Thank you. So that is all the questions that we have. Anna is right. For our partners in the media, there is a press conference tomorrow morning at 10 o'clock at Hurricane Harbor, otherwise known as Waterworld in Concord. So we hope that we will see you there. I really want to thank our panelists for taking the time out of a crazy busy day to be here with us. This video will remain on Facebook. You can watch it anytime, but also for the media, you can download it from YouTube if you'd like to edit it for your newscast this evening. So thanks for joining us, and we will hopefully see you all tomorrow.